morning. Thank you for coming today. We are so pleased to be celebrating 15 years of successful collaboration and learning together. Better Health Partnership, formerly known as Better Health Greater Cleveland, has been working since 2007 to collectively improve healthcare and health in Northeast Ohio. Through the years, we have learned that complex issues cannot be solved by one organization alone. In our work, we have demonstrated how collaboration, led by our trusted stakeholders and informed by actionable data, enables system-level positive change. Our partners include health systems, social service agencies, public health departments, government agencies, foundations, employers, health insurers, schools, and many other community-based organizations. These stakeholders proudly deliver innovative, evidence-based solutions designed to achieve exceptional health value and eradicate health disparities in Northeast Ohio. I would like right now to recognize two individuals. I was supposed to go there, sorry. And we have been fortunate to have their dedicated and talented leadership. Carol Kashub, please stand up. Where are you? Oh, in the back. Carol was our former business and events manager for Better Health. She is known, or was known, as the glue that held the organization together. She was incredibly dedicated to our members, staff, and board. Carol recently retired, and we miss her. We wish her well as she enters this next phase of her life to enjoy some much-deserved family time. Please join me again in giving Carol a round of applause. Dr. Donald Ford, would you please stand up? Dr. Ford has been a physician leader for many years with Better Health Partnerships. He has served as MC for many learning collabs, both in person and online. He's been the chair of the Health Metrics Advisory Committee, and lastly, as our Chief Medical Officer. At the end of 2021, Donald became the chair of family medicine at Cleveland Clinic and needed to transition from his many Better Health roles. However, we were fortunate that he agreed to join the Better Health Board of Directors, where he also serves on the governance committee. So again, let's give Donald a big round of applause. So today, I am pleased to present the inaugural Better Health Partnership Collaborative Championship Award. This award was designed to reflect the evolution of Better Health. What began as a small organization known for its collaborative work in the community and our ability to serve, what began as a small organization focusing on data and health improvements has evolved into an organization known for its collaborative work in the community and our ability to serve as a neutral convener in many forums. This is the first of what will be an annual tradition for Better Health. I would like to invite Dr. Akram Boutros to the stage, President and CEO of Metro Health System, to receive the 2022 Better Health Partnership Collaborative Champion Award. Dr. Boutros, thank you for your generous support of our organization over the past 10 years. Your leadership, mentorship, and friendship have been gifts to the board and staff at Better Health. When you look at this reward, Please remember the impact you have had on our organization. You have helped us become who we are today. Let's give another round of applause for Dr. Boutrous. Dr. Boutrous, when you arrived at Metro Health, you laid out a bold vision to make Metro the most admired public health system in the country, and you have done just that. Under your leadership, Metro Health has dramatically expanded access to care, created the Institute for Hope to address persistent social challenges that impact health, and embarked on a $1 billion transformation of the main campus and surrounding neighborhood. This includes 25 acres of green space, making the Metro Health Click Center the first hospital in a park in the country. You have accomplished much in your time here. As you leave your role as president and CEO, we look forward to your continued efforts to engage the community in higher levels of collaboration. There are many complex issues to address: public safety, poverty, and structural racism, to name a few areas impacting public health. Please know that Better Health will always support your efforts, and we look forward to working with you to address these challenges. I think now is a good time to share a few words with your audience about your plans for the future.
Thank you very much. So for those of you, and there are many here who work with me, you know I don't usually take a lot of vacation days, and today is vacation day for me, so I came. I'll tell you why I couldn't resist. I found out that I was the opening act for Amy Acton. That's like being the opening act for the Rolling Stones. So I'm like, yeah, I'm coming in. So folks wanted me to talk to you a little bit about one of the things I'm going to be focusing on. That is going to, I think, be, I hope, to start in Cleveland and create a change throughout the nation. But let me start with when I came from Egypt about 48 years ago. I didn't speak a word of English, and as I was learning from my English second language teacher, I got confused with a lot of different words and sayings, and I asked her once. After about a year and a half, I asked what something meant, and I said, well, does this also mean that? She said, yes, and we went on and on and on, and I remember she said, well, that's the problem sometimes with the English language. When you talk about everything being one type of issue, then nothing is that type of issue. So for me, the reason I'm going to be talking about this is because I've been seeing a lot of things being talked about as a public health crisis, right? So if everything is a public health crisis, then there's nothing that is a public health crisis. And we gotta stop using monikers to capture people's attention. I think we just have to be honest. We have to be honest. When I was asked to lead first year Cleveland, I got really upset about 4 to 5 months into the process when everybody talked about we have an infant mortality issue in Cleveland. I got so mad, and I said, look, it's not an infant mortality issue. It's black babies dying. That's why you need to call it, because that's what's happened. An infant mortality problem sounds so sterile. You have the impact on people's lives is so marked that we shouldn't be trying to save each other's feelings by just saying, putting a moniker on it. So I think that's what needs to happen. And so what I'm going to be focusing on, and what I hope to do within a year, and I know most people think I'm absolutely out of my mind to think this will be done, is to raise $100 million to create the National Center for the Reduction of Gun Violence in Cleveland. So, and I am sick and tired of talking about policy. Because I have to tell you is that not one human being was shot by policy. Okay, not one human being was saved by policy. We have to be able to help the people who are getting shot and the people who are doing the shooting. There are human beings, and that's what we need to be able to do. So the idea that I've come up with, and I hope that the folks who committed to me are going to continue that commitment, is that I want 10 organizations in Cleveland, governmental organizations, not-for-profits, health systems, corporations, and I have 6 of them who are verbally committed already to raise $1 million to give this new center $1 million a year for 5 years. That's the commitment. So I have a verbal commitment for $30 million. I want to raise 4 more of those. None of those dollars will be raised from philanthropic causes. We have to be, the people who live here, the people who work here, the people who take care of people here, have to actually make that investment. Because we can't continue to depend on philanthropy. So once we get to $50 million, my challenge will be to go to the philanthropic organization and says, all right, I did it and I don't know what I'm doing. You guys raise $50 million and let's get it. Let's have $100 million committed to this cause. I don't want to be on the board of this center. I don't want to be CEO. I am not the expert in this. I just know it needs to be addressed. And I guess I'm the only idiot who says these things out loud and tries to get them done. So I'm going to try to do that for Cleveland. I'm going to tell you a couple of things that got me to this point. First is that at Metro Health, the average cost of a gunshot wound, you understand this is somebody who gets grazed and goes home from the emergency room, and we have plenty of people who do that, to the person who has a spinal cord injury and for the rest of their life needs support. I'm only talking about the acute episode here. The acute episode of care that Metro Health provides for every gunshot victim costs $55,000 a person. That, to me, is equal for an in-state college education for a human being. Why are we spending money after the fact? Why aren't we helping people before these things happen? So, other statistic is that in Cuyahoga County, 82% of gun homicides happen in 19% of the zip codes. And in about 20% of the actual streets, of those zip codes, I can identify 50% of the victims. So this is not a Cuyahoga County problem. This is specific street by street problem. So I remember, I think, I'm not sure, but I think it was Hillary Clinton who said, it takes a village to raise a child. I'm not sure. I was raised by my mom and dad, and my mom didn't do such a good job, so she gave me to Suzanne, who has been with me since 18 years, and I was 18 years old, and she's been trying to raise me for the past 42 years. I think train me, not raise me. Earlier on, she tried to raise me, and now she's trying to train me. But I absolutely know it takes a village to fail a child. And we have been failing our children in Cleveland, honestly, for over 100 years. When I learned about what the purpose of the Cleveland Foundation was, and I think it was created 105 years ago, and it was the first community foundation in the country, in the world actually, and how much money they poured into doing good things. And I'm not a sentimental guy, so I look at the condition of the people 105 years ago that we were trying to help, and the condition of the people now who we're trying to help. I think it's worse off. So we're really highly ineffective, right? So I think it's going to take individual effort, connections with people, to reduce this issue. I think also some of you know that I just say what's on my mind, and I don't really worry about if people are going to cancel me. My family tried to cancel me, and they couldn't do it. So here's one of the things that finally made me say I have to do something about it. Women do not use guns to settle arguments. Literally from eternity. That's not the way they do that. You guys talk a lot more, are meaner to each other psychologically. You do not pick up baseball bats. You do not pick up guns to shoot one another. In the past 2 years, there's been a 300% increase in women being arrested with guns in Cleveland. 300%. The episode that got me to do this is that when our police department arrested 13 to 22-year-olds who came to the emergency room because one of their friends was shot, and all of them were girls. I don't know that we recognize that this is crossing the Rubicon, that this is becoming so normal that people who never used this method to settle arguments or to deal with issues are now finding it acceptable. So we got to do something. And I will tell you is that I know also that we have failed those children because we have consistently had low expectations of them. We've said to them, it's okay. Things are terrible. You're not, the future is really hard. Don't worry about it. It is what it is. There's nothing, no one has ever done great things by being told they can't do it. We have to be able to have high expectations of our children. We have to support them unconditionally for them to reach those high expectations. We have to give them options. When we started the first high school in the nation, I'm still the only high school in the nation inside Metro Health. Again, I was told I was nuts. I was told I was nuts by some of my own staff. And they said, what do you want to accomplish? I said, I want to give people a pathway. I said, that's it. That's all I want to do. I would like to be able to help people have a pathway. to see themselves in a different place, know how to get there, and know that they have the support to get there. And that's what we've done. We're about to graduate our 5th class. We have approximately 30% of, they're all, by the way, all the students are CMSD students. We do not select them. They just come to us. We don't know any of them when they start at our school. 30+% of them are English second language. 40% of them are head of household. Over 90% of them graduate within 4 years. And 100% of them get accepted into a 2-year or a 4-year college. We don't teach them anything different. We just invest in them individually. And that investment is done by most of our employees who volunteer, who talk to the students one-on-one, who become the trusted adult that they need to talk to. And we've seen people change their lives as a result of that. So that's what we're going to have to do to be able to curb gun violence, is to actually give people a pathway to something great that they want to be in. People don't shoot other people because they believe they have a bright future. You hear about the athlete, the extraordinary athlete who got shot. You don't hear typically about the extraordinary athlete who shot somebody. Okay? When you have a future, when you have a pathway, you tend to make a lot better choices. So we're going to have to remove a lot of stress from a lot of people's lives. Now, I will tell you is that none of us are immune from the impact of stress. And toxic stress, chronic toxic stress, doesn't matter who you are, how brilliant you are, where you were raised, and what moral compass you have, how faithful you are, doesn't matter. If we put you under the same stressful condition that these kids are in, you are going to make bad decisions. We actually know your ability to solve complex problems gets reduced tremendously. And that is coupled with your ability to have what is known as delayed gratification. Those two issues, not being able to solve complex problems and not being able to delay gratification, cause a lot of people to pick up guns that should never ever do that. So that's what I'm going to try to do. I'm going to try to do it by the end of 2023. I have already gotten commitments from the FBI. I've already gotten commitments from U.S. Attorney's Office. I've gotten commitments from our new head of the ATF. He's a Clevelander, by the way. So, and we want to create it here. And we want to be able to figure out real solutions that help Greater Cleveland, Cuyahoga County, Northeast Ohio, and help implement those throughout the country. So no policy, just practical solutions. There are over 400 million guns in America. I don't think a new policy is going to be able to help that. With that many guns, we just got to be able to figure out how to help these kids, and most of them are kids, to be able to use some other means to solve whatever issue that they have, and to give them hope and pathways. And this really goes with our, at least for me, the change we had at Metro Health. We have a new logo. I think many people have seen it. It's a logo of inclusion. It's the medical cross, and it's made out of dots of different colors. Okay, but the new tagline is devoted to hope, health, and humanity. I think we need to, the healthcare systems have done a lot of really good work at focusing on the health part. I think some of us are going to have to focus a lot more on hope and humanity. And I think one of the things we'll be able to do is bring hope to these children, and we'll bring humanity back to Cuyahoga County and to each other. So thank you very much for giving me the opportunity to talk about this. And by the way, please email me. I am looking, I know I definitely can't do this alone. I've never done anything alone except take a shower. That's the only thing. But if you are interested in helping support this, please let me know. I'm going to need a lot of folks who are smarter and wiser than me. I have the tendency to come up with good ideas, but I really need a lot of great people to execute. I remember when I'm looking at Sue Fuhrer when she was finishing her time at the Stokes VA, and she was the sitting CEO, and I said, hey, I have this idea about this Institute for Hope. She was like, oh, how far along are you? I said, I have this idea with the Institute for Hope. Would you become its president? And over lunch, somehow I convinced her to take the leap, and she and her team have been doing this incredible work that is today is really the most comprehensive approach to social drivers of health in the country. So as you can tell, I just come up with good ideas, and I think I need lots of folks who actually are smarter who can do this. So Amy, you didn't hear me when you were outside, were you? That I'm really on vacation, and the only reason I came is because I'm your opening act. So I had the privilege, and I don't want to introduce her, but I had the privilege of meeting Dr. Amy Acton the day that she and the governor spoke about COVID. They came to Metro Health to tour our infectious disease unit, and they were just talking a lot in one of the side rooms. I'm like, okay, this is not going to be good. They're going to make a big announcement. And I'm supposed to speak after them, and I have no idea what they're going to say, right? So thankfully, I've been reading the newspaper, so I knew a little about it. But since that day, we have become close. We've worked with each other through the entire time at the Department of Health, and she's done a spectacular job, and now I can actually call her a friend. So Amy, you're the only reason I'm here. Thank you very much.